One of the major things that we aim for in rehabilitation is to have patients return to the quality of life that they had prior to their disability. My first patient that I saw actually treated with AposTherapy was one of our employees who went with us to Apos to just get a trial fit to see how things would work. And had that individual not been somebody that we worked with here at Montefiore and came with us to the Apos clinic, I would have thought that this was a plant, because the individual went from having a very painful gait, which was slow, waddling, and very, very difficult to do, to wearing the AposTherapy, smiling, and going almost twice as fast with no impediment in her gait, and going, "This is awesome." And I'm thinking, this just couldn't be true, that a treatment that was simply basically changing the biomechanics could make somebody improve so much so quickly. But we've had several other individuals who have had the same effects, which means that for the right patients, I think this is an absolutely fabulous treatment. One of our big landmarks is we have insurance coverage with a couple of carriers at this point. We treat the Montefiore employees who are covered by the Montefiore Benefit Program, and we also have had an essentially landmark agreement with Health First that we're actually able to cover their patients. This will be done on a limited basis just for patients who have knee, back, and hip pain. In particular, I think the populations that we would target would be people who are on their feet all day and who, because of this, are developing degenerative joint changes. A good example would be nurses, individuals who are walking all day. These individuals would benefit from making sure that their biomechanics and the muscles that support their knees, hips, and backs are strengthened in the appropriate fashion. They also are often working and don't have the time to do a standard exercise program. So having a treatment like Apos that you just put the shoes on when you go home, wear them for an hour a day, and every day get basically a regenerative treatment would be a fabulous way for us to actually initially apply this treatment. I like to phrase it that you get your life back. A lot of the patients aren't coming to us because, oh, I have an x-ray that shows that I have arthritis, or, oh, I can only bend my hip a certain number of degrees. They're coming because I am not able to play with my grandchild. I'm not able to take the walk I used to. I can't golf like I did. Or I'm having more trouble at work and I can't climb the stairs. So this will be actually a tremendous benefit for a lot of our patients, that the lifestyle and the quality of life that they used to prior to their injury have will return. So our goal here really with AposTherapy is not just reduction of pain, but it's to restore people to the quality of life and the activities that they had before they started to have symptoms.